Great. So I think we're on 12:30. Good morning, everybody, and welcome to our webinar this morning from the Waterford Chamber of Commerce Wellness, part of the Waterford Chamber of Commerce Wellness Month in partnership with UPMC. And we have a month-long programme of events with our colleagues in UPMC around the whole area of wellness. And we were delighted to have Dualtach's colleagues last week around the whole area of exercise and the positive mental health area, which is was really at the start of a number of conversations that we will be having in the longer term. Today we're joined by Dualtach Colgáin from UPMC, and he's going to be talking around the subject of recovery and injury prevention in sport. Before I hand you over to Dualtach, just to let you know, and I'll just remind you at the end of the webinar that we have a great event coming up on the 31st of March at 5:30 in the evening, actually out in out by UPMC, the WIT Arena, where we have a networking walk with Olympian Phil Healy, who's also an ambassador for UPMC. So it's just to throw your runners in the car, meet us out at the car park there at the start of the Greenway. We'll try and keep up with Phil for 25 minutes, half an hour, and we'll have a quick cup of coffee and a chance to meet Phil and some of our other chamber members at that walk. So that's the 31st of March at 5:30, and you can register on the website. So without further ado, I just want to hand over to Dr. Dualtach Colgáin. I was reading the bio earlier, Dualtach. There's not too much areas that you haven't covered in terms of, elite sportsmanship yourself, in terms of rowing, and also looking after a lot of different age levels for Gaelic football in Meath. I was explaining to Dualtach, Waterford is actually coming into its own in terms of Gaelic football, so keep an eye on us. And we're really looking forward to this talk, and obviously there's space for questions and answers. I think we might try and keep the questions and answers till the end, but if there's something that that you need to ask in the meantime, just use the chat box as well. And yeah, we're really looking forward to this. And Dualtach, over to you.
Thanks, Avril, and thanks, Brian. And it's great to be asked to give this talk today. What I'm specifically going to be talking about is recovery and injury prevention in sport. Now, you'll probably see from my slides that there's a lot of kind of emphasis on GAA, because that's the the main sport I work in is with Gaelic football, but this is applicable to all sports, maybe some minor modifications, but it's very general advice, and I'll kind of go through everything of what I'm going to speak about throughout the talk. So my background is I'm working in the UPMC Sports Medicine Clinic up in the WIT Arena, where actually the walk with Phil Healy will be starting from. So we have a clinic there, and that's kind of where I'm based out of, and I work in a facility here in Dublin as well. So my current sporting role is with the Meath senior footballers. So I work as their team doctor, and thankfully we got our first win of the season yesterday. So don't know if we'll be down in Division 4 just yet, but we're lucky to be kind of safe, I hope anyways, for the rest of the season. And then I look after the underage teams with Meath as well. So I'll be the clinical lead there, where I oversee the medical care for all of our underage teams as well, and kind of would have physios with each team and liaise very closely with them on any issues that may arise. Previously, I've worked with Dualtach FC, the League of Ireland team, and Shelburne, their ladies team in the Women's National League. So a lot of field-based sport that I work in, but my own personal background as a sports person is in sailing. I was an international athlete in sailing, and I was also a rowing coach as well for a while. And I coached UC Boat Club to a national title. So have lots of interest across all different types of sport, and that ties in nicely to the clinic, where we have people coming from every background, and not just sporting backgrounds as well. We'd see a lot of people that would have occupational injuries just out doing kind of weekend warrior type exercise as well. So we do see a massive kind of variation of stuff in the clinic, and not just the elite athletes that people might associate with such a clinic. And where it all began, I suppose, I initially trained as a chartered physiotherapist many years ago now, and for various different reasons, I kind of got the itch to want to do a bit more. So I went back and studied medicine in University of Glasgow in Scotland after completing my master's in sports and exercise medicine. So I suppose what we're going to talk about is understanding injuries, first of all. And then what I'm going to do is I'm going to look at a case study of a real patient, a real person who was injured and how they recovered from that injury. And then look a little bit about prevention of injury. So what can we do to try and offset these types of issues that inevitably come up with by taking sport and exercise, and how we can improve our bodies to minimize that as much as possible. And then looking at a bit of pre-season screening as well, which kind of ties into the prevention side of things. So like I said, this is probably a little bit kind of more leaning towards a GAA type setting, but it's very applicable to all sport. And if there's anyone has any questions, if you want to jump in, you can, or keep until the end. I've no problem taking questions as we go along. So we'll kind of just get straight to it. Really, the biggest issue we have in the clinic is that people come to us after sometimes a number of weeks, sometimes a number of months, and they're usually in a fairly bad way. And that goes right from our elite athletes who don't want to miss any time out, right up to, people who like to go for a walk on a Sunday morning, and all of a sudden there's a little bit of a niggle, and that turns into an injury where they can't go for that walk on a Sunday morning, and that affects their life. So what I always say is, don't leave it. Just if you feel like there's something wrong, put the hand up, as we say to the footballers, and seek the medical advice. It doesn't really matter how you get it. It's important to chat to somebody, and it's not necessarily a doctor. It could be your chartered physiotherapist as well. If you're in pain, it's something to seek out, or even maybe it doesn't even need to be pain. It can be some sort of discomfort, or if you're feeling unwell or whatever it is. If you speak to somebody first, kind of early on, it usually, if you flag it early, you can usually treat that small issue before it becomes a large issue, and you can get a good outcome. So we often find with the Meath footballers, or any team I've worked with, that if there's a few games kind of coming up week after week, they might feel something after, say, the first game, and they've 2 more games before there's a week off. They might feel something and continue to train that week instead of saying something to us, and then all of a sudden they've missed 2 games. Whereas if they flag it early, they might get it treated and be able to continue on with the normal game schedule. So it's very important to speak to someone. And if you don't flag these things early, they can develop into something a little bit more serious, and that in turn can lead to complications and a longer recovery time. So this is kind of where we start talking about the recovery. It's not necessarily to do with if you're well and you're doing recovery after a training session or a match or whatever it is. It's about recovery from injury as well. So that's kind of what I'm going to touch on throughout the talk. So I suppose we're all very aware of what we've been through for the last 2 years, and we've been locked out of. You can see from the picture there, we've been locked out of Croke Park and all the various sporting facilities throughout the whole country, and indeed the whole world, apart from maybe the very elite sports that have been allowed to continue. And that was for good reason, with the public health concerns that were surrounding that. Now, what that has done is it's led to new injury trends. So we found that during the main lockdown periods, when people were restricted to their 2-kilometre limits and the 5-kilometre limits and the county limits, that people just weren't exercising as they usually would. Poor weather as well during the winter periods, and people were basically, they were staying at home. They were becoming more sedentary, and they were, I suppose, deconditioning, for want of a better word. That led to its own problems. When people got back to exercise and stuff like that, the restrictions were lifted and stuff like that. People began to exercise again, but what they did was they exercised at maybe a pre-pandemic or a pre-lockdown type of intensity. What that did was people had deconditioned and they went straight back into it, and all of a sudden you're overloading your body, giving your body a massive shock, and that was leading to injuries. So we saw a lot of tendon injuries, and I'll touch on the kind of tendon injuries in a few minutes. So that kind of led to a lot of tendon injuries, and then muscle injuries as well. particularly we would have seen with a lot of the field athletes that were running in straight lines, and then all of a sudden they're back in the field and they're doing a lot of turning and cutting movements, and that would cause a lot of muscle injuries as well. On top of that was people making a lot of banana bread and a lot of sourdough, and there was a lot of weight gain throughout the lockdown periods. And I've heard a phrase more than once, and people that gained what we call the COVID stone, and then obviously people, once they were permitted to do so, were back out running, back out kind of doing the things they like to do. But again, they to try and shift the weight, and a lot of people were very keen on doing this and developed injuries as a result. So what I would say, we're probably past this now, but it's still very, very relevant. If you're coming back to exercise after a period of in exercise or less than you would normally do, it's very, very important that we control the amount of exercise or sport we do relative to what you're doing in the period prior to that. So that's kind of the message from how we've come out of COVID and the types of injuries that we've seen. So I suppose looking at the common type injuries that we see, I suppose we can break it down into 3 different types of injuries. We've got soft tissue injuries, which would be related to the muscles, and that can be anything from a muscle injury to a tear, to even something like an impact injury, say in Gaelic football or any kind of field sports where there's bruising or what we call a hematoma. So that's kind of, if you look at the mouse here, that'd be over the red, that'd be a muscle, so that'd be considered a soft tissue. The next type of injury we can develop are tendon injuries, and tendons, they're the tissues that connect muscles to bone, or they connect one structure to a bone. So if you look here, this is a diagram of the knee joint, and we have the muscle here, which is in kind of red, and then the tendon in white, and that's connecting onto the kneecap or the patella, and that's kind of one of these common areas that can become injured, particularly after that COVID period. And then the next thing are joint injuries. So joints are like your knees, hips, ankles, elbows, wrists, shoulders. And joint injuries, they would usually occur to ligaments or the cartilage within those joints. So the ligaments, they would attach bone to bone. So you can see here where the mouse is, that's the lateral collateral ligament of the knee. And then you've got inside the knee joint itself, you've got your cruciate ligaments, so your ACL, which is your anterior cruciate ligament, and your PCL, posterior cruciate ligament, and then ligaments again on the other side. And we've got cartilage, which is this blue kind of tissue you can see here over the mouse. And that's kind of like acts as a cushion between the joints and allows joints to move freely. So if there's a tear in the cartilage or a tear in a ligament, that can cause pain, it can cause the joint to be unstable, and it can cause the joint to click or lock, say, if there's damage to the cartilage. So they're kind of 3 different kind of most common types of injuries. So when you look at a type of injury, the way I like to say it is your recovery starts the minute the injury actually happens. Okay, so that's, you say, for example, you're on a field, there's a collision, get a bang, get a knock, you get a bruise. That's when your body starts automatically to recover. It starts inflammatory process and recovery process. So there's a bit of a kind of a timeline of how you kind of go through it. First of all, you'd be seen by a doctor or a chartered physiotherapist, and that's usually done pitch side or in a clinic. And that's the first assessment that's done. There may be some investigations needed, so things like x-rays, MRIs, blood tests, multiple different types of investigations. And then what those investigations and your assessment allow you to do, they allow you to make a diagnosis of what the particular type of injury is. Once you know what type of injury it is, then you need to make a plan. And that's really where the treatment and recovery process starts. And then once you go through the various stages of treatment and recovery, you start looking at pre-injury activity and returning to that. Okay, so this is an example here on the right hand side of a player for Glasgow Celtic, Christopher Gillian, who had a very severe knee injury, and he was 402 days out with his injury due to the collision that he had, needing surgery, and then the rehabilitation process. But all that recovery starts from the time of injury. So He just made his return there recently for Celtic, and has been, a key member of their team as they go to reclaim the Scottish Premier League, hopefully. So this is the case study that I'd like to discuss. So this the picture on the right there, it's not the player that was injured, and I have consent to share this information. Okay, so this was a 21-year-old inter-county footballer, so a very fit young man and no previous hamstring injury histories. He was right-footed, and we're out training in Dunganny, so that's Meath's Centre of Excellence. And it was during a pre-season training session, so probably on the back of not having done much exercise in the previous period, that might have been the pre-season training session, which are usually quite heavy going and quite hard. So this particular player was solo on the ball. So for anyone who's not familiar with Gaelic football, he had his right hip kind of flexed at about 90 degrees, as you can see in the picture here, and then his knee was in full extension, so the straight leg and the hip flexed. And for if you're looking at purely the gait pattern, or the pattern where he was through his running phase, he was in the late swing phase where there was lengthening happening of the muscle. And as he was in this type of scenario, he had a very sudden onset right-sided severe hamstring pain. So he basically pulled his hamstring. So that's kind of we're kind of setting the scene to what's going on. So the mechanism of the injury, how the injury happens, is really important. If you become injured, to let the person that's looking after you know how it happened, because that can often determine what type of injury it is and how the injury can be managed in future. So when we examined him pitch side straight away, so he had very limited range of motion. So that's kind of, he couldn't really move that hip or knee without severe pain, and both actively and passively. So actively would be asking him to do the movement. Passively would be the clinician and myself and the physiotherapists that were there at the time to move those joints, and he was very limited due to his pain. He was very tender as well over the muscle belly of biceps femoris, which is one of the hamstring muscles, and he had swelling as well and subsequent bruising. So the swelling is due to the tear in the muscle and bleeding within the area, and then the bruising is again a consequence of that. So at the time of the injury, he wasn't able to weight bear, so we gave him crutches to be able to mobilize, basically, which is very important that after these injuries that the players can get moving in one sense. Very important when we examined them that there was no tenderness at the ischiotuberosity, which is, if we're all sitting down at the moment, that's the bone that you're sitting on. If you move kind of side to side, that's your ischiotuberosity, the little bones that you're sitting on. And that's where your hamstrings are attached, and that's where they kind of start, and then they go down your thigh and they attach the back of your knee at the other side of your knee. Okay. Now, the importance of the tenderness at the ischiotuberosity, if anyone remembers when Paul O'Connell played his last game for Ireland, he had a very severe injury where he tore his hamstring. He actually tore the hamstring off the ischiotuberosity. So that's something that we always have to pay attention to, particularly with hamstring injuries. So what did we continue to do then? So we arranged an MRI scan for this particular player. And if you see from the images there, the hamstrings and the muscles are there in grey, and then you've got this kind of nice, well, not nice area, but this area of white here, and it's kind of extending down, and that's inflammation from the injury. Okay, so that's from the bleeding into the area, and then the inflammation is that start of that recovery process. So he had quite a severe injury, which was a grade 2C, and that's kind of what we do when we're doing our assessments. We ask the radiologists to grade these injuries in certain ways so we know how to treat them and how to start that recovery process and get it on to the next level. So he had a tendon tear about 50% of the tendon diameter at the proximal myotendinous junction. So what does all that mean? So the tendon, like we described in the previous slides, that attaches the muscle to bone, there was a tear in the tendon, and then the myotendinous junction in the proximal area. So proximal means it's closer to the top of the muscle. Okay, and then the myotendinous junction, that's where the muscle and the tendon connect. So there was a tendon tear there. Okay, so how do we treat this? And this is really kind of where the recovery process really kind of gets going. So he was seen by an orthopedic specialist, and we kind of got their opinion to make sure that there was no surgical input required. Thankfully, there wasn't, but he was put in a knee brace for a number of weeks to allow that muscle and tendon to heal as much as possible. And then he was put on crutches as well, just for comfort and to allow him to mobilize with the knee brace. And then he was started in his rehabilitation process with the chartered physiotherapist. So what they started was just some very basic strengthening within the muscles, and then bringing in kind of movement and various different things as these muscles start to heal and recover. So there's a very specific pathway that you have to follow with these types of injuries, and that's why it's important to link in with the chartered physiotherapist when you're doing this type of particularly return from these types of injuries. Because if a player may feel that there's no pain in the area, and that's very, very common, that you might have players that develop a hamstring injury, do a certain amount of rehab, feel fine, go for a run, again feel fine, and then return to play, and that might be premature. They might have a bit of weakness in the area, and it's only when they return to play and go back to high intensities that things kind of recur, or they get some more problems, or they try some change of direction. So it's very important that when you're doing your rehabilitation, that you follow that advice that's given to you by your physio, allowing for that return to play. And while it may take a week or two longer, in the long run, you're probably better off, because you're avoiding recurrence of injury. So the treatment phase is usually very injury specific. So no two players are the same, and it all depends on the type of injury and the severity of injury. So if we look at the case study there, that was a hamstring injury, and that has a very specific type of return to play protocol. If you look at the picture on the right here, which is not a site for easy viewing, but that's Tom Parsons, player for Mayo, who had a very severe knee injury with multiple ligament injuries and some cartilage injury as well. So you have to look at the treatment phase. So is there surgical management or non-surgical management? And for Tom Parsons here, unfortunately, he needed quite extensive surgery, and then that required significant rehab and recovery as well. The previous case there, it was a non-surgical management again, and the rehab and recovery phases were different as a result. Okay, so very important that the treatment phase is well planned, and the type of outcomes are based usually. Your outcome of when you return to play are usually based on whether it's surgical or non-surgical management. Very important when players are going through the rehab and recovery stages, that there's assessment of progress, and it's staged and it's phased, within your progression of rehab. So, a lot of people think if, for example, you rupture your ACL, have ACL surgery, that it's a 6 to 9 month return to play. It's not always the case, because sometimes you can run into specific kind of, everyone hits a speed bump every now and again, and it's important that you manage a player's expectations, and that they're assessed regularly to allow that progression and rehab, and that they're not returned too soon, or if they're hitting their markers, that they may return a little bit sooner. For some injuries, like a chronic injury, there may be a maintenance phase as well in that recovery. So when they return to activity or play, they may require some additional rehab or work to do prior to maybe a training session or a warm-up. And this applies to all sports, not just field sports, that if you have issues with tendinopathy and stuff like that, some people need to do some tendon loading beforehand, get themselves warmed up, do some active activity work and stuff like that prior to going and doing that warm-up or training session, if it's by themselves, if they're a runner, or in with the team. So that's kind of recovery in the injured setting. So there's obviously the uninjured setting as well. So this applies to all athletes. Again, I've probably pre-training / match, but this can apply to, again, the weekend warrior, right up to someone who runs a 5K, 10K marathon runner. It's very important that you look at the 3 different kind of scenarios really that you can have. So you can have pre-training and match, post-training and match, or race, or just exercise. pre-post exercise really is probably the more appropriate title there. And then the off days as well. So what you're doing when you're not doing exercise or training or playing matches or running, whatever your type of exercise is, and how you approach those types of exercise. Now, we could probably talk all day just about pre-training or pre-exercise, post-exercise on your off days, but we're kind of limited in time. So I've kind of put a few bullet points here together. So if you look at the first thing, hydration is massively important, and fueling the body as well. That's both pre and post exercise. So hydration obviously is very important to allow you to perform exercise to the best of your ability. Studies have shown that if you're not well hydrated, you become fatigued easier, and when you become fatigued, you make more mistakes. When you make mistakes, you become injured. Same thing with nutrition and fueling. So if you're not well fueled and you don't have the energy, again, your performance can be affected. You become fatigued again, you make mistakes, and injuries can occur. And that's the fueling is done pre and post exercise. So pre-exercise to allow you to do that exercise effectively, and then post-exercise to allow your body to recover. So that's with things like protein and carbohydrate, usually post-exercise, and more of a carbohydrate pre-exercise. That's a very general statement that I've just made, and it depends on your sport, type of sport you're doing, and how long you're doing it for. And it's very important during exercise as well that fueling and hydration are at the top of any athlete's list. Flexibility is important, and that's usually done with some activation work as well, usually in a team setting as a group. In the kind of post-exercise, or post-match or post-training, there might be some non-weight bearing exercise done in what we'd call a recovery day. So the non-weight bearing exercises usually would be getting on a bike with very low resistance, getting in for a swim, or doing some kind of cross training and stuff like that. On something like an elliptical thrust trainer, where you're offloading the joints, but you're just moving the next day to prevent any kind of muscle stiffness and kind of feeling kind of stiff and sore after. It's good to keep moving the next day. Cold therapy, so some people like to use ice baths. Sean Boylan was doing it with the Meath footballers back in the 80s when they were winning all those All-Irelands. He was getting them into the freezing cold sea up in Bettystown there. So it's been around for years. It's probably a little bit more high tech now, with cryo chambers and stuff like that. But if those things aren't available to you, there's some lovely swim spots down in Waterford as well to just get into the cold water and get yourself moving, and you can swim within that cold water. Obviously, don't stay in too long because there's a risk of hypothermia, but that non-weight bearing exercise can be done as well. It's very important as well, and this is probably becoming more prevalent, and I think it's particularly from a performance point of view, that the sports psychology side of things is brought into it, and mindfulness and stuff like that as well, where people, if they are injured, that part is addressed as well, that how people feel about their injuries and how they recover from injuries as well. And if there's a good psychologist in place, or if it's needed, that can help with someone deal with their injury. And as well in the uninjured setting, people have fear of becoming re-injured. Probably sometimes the last thing people want to do after playing a tough match or running a tough marathon or whatever it is doing that recovery. But if the mindset is right, that makes it a little bit easier. And then we all kind of lead very, very busy lives at the moment, but sleep and rest play a massive role in recovery, particularly after exercise. But then getting back to the fatigue side of things, if we're not slept well and rested well prior to exercise, you can put yourself at a higher risk of injury. So moving on to, I suppose, the injury prevention side of things. I'm looking just specifically at the GAA 15 because I'm just mindful of time, but this is an injury prevention program that was developed by the GAA, and that's specific to the GAA based on the FIFA 11 Plus, which is an injury prevention program that was developed by FIFA for soccer. So it's basically a 15-minute injury prevention program for hurling or camogie and for Gaelic football teams, so ladies and men's Gaelic football. And the aim is to reduce injuries. Now, this can be applied to all sport. I think it's very important that if you look at it, the exercises that it goes through, it is applicable to all sport, but it's probably more specific to Gaelic games. And there's 3 sections to it, and you can access this through the GAA website. Just Google GAA 15. It's the first thing that pops up. Best thing about it is it's easy to implement. There are no cost implications with it, and it's freely available. And whether you're looking after an under-9s team or a senior inter-county team, I think it's still very relevant. And the data that they've produced on the back of this would support that statement. So there's 3 different sections. The first section is just a running, so kind of a warm-up running, and that usually takes about 5 minutes. And if you look at it through the website, I think it's really important, just even to take a look. It breaks it right down, and there's videos and stuff on it. The next thing then is probably more getting into the movements that would be involved with the field sport. So looking at a strengthening part of it, balancing, jumping, and then the hamstrings. And I'll touch on the hamstrings now in a second. And then the last part is just more sport specific exercise, and that's probably where it differs, being specific to Gaelic games. But like I said, the exercises and the various injury prevention parts to it are all quite relevant. So the reason I'm kind of touching on the hamstring injury prevention, I suppose, is because in Gaelic games, and particularly Gaelic football, it's the most frequent injury. So if you were to look at, one specific athlete, so if they were to do 1,000 hours of their chosen sport, so Gaelic football in this instance, they would have 2.2 injuries per 1,000 hours. So every 100 hours or so, you're going to get a hamstring injury. That's what the data shows. This is, again, more likely to happen in a match play situation where it's at a high intensity than in training. And this, it mostly happens while running. So 73%, so 3/4 of the injuries are happening while running. Where it how it affects the player, how it affects the team, and how it affects their outcomes, it's the average time loss through these injuries is about 26 days. So we're probably getting close to about 4 weeks. And that just depends on the type of injury. And that we remember back to the case study, that'll all depend on how that injury occurs, the severity of it, and how it's rehabilitated. And it accounts for 21% of the total amount of injuries within Gaelic football. So that's why I think in the GAA 15, it's very specific to hamstrings, that there is a portion there for it, because it does take up a lot of our time in the clinic as well. So it is comparable to soccer as well. So that would make sense, because they're both high intensity explosive running games, and about double that of rugby. Rugby wouldn't be as explosive, but it definitely does occur. And there's papers there to show that it's very similar in soccer as it would be as well in Australian rules, which, if you think about it, we have our compromise rules series with Australian rules every 2 years, and they have about 19% of injuries, and 81% of their injuries occur while sprinting, probably a little bit more than what we have while running. So that's quite interesting. So that's why we do the injury prevention on the party of the GAA 15. Now, from an injury prevention point of view, I suppose if we can screen and figure out what a player may be lacking, that might help identify some discrepancies or factors for an injury or for injury prevention. Now, it's very important to note that screening it's not a predictor of injury. It doesn't give you a better injury prognosis. There's been plenty of studies that have proven that. It's more of a benchmark of function and performance. And so it's good in identifying maybe a weakness that a player may have and that they can be addressed. But like I said, it's more, the focus should really be on the injury prevention, using the GAA 15, FIFA 11 plus in soccer. And that's kind of where I'm kind of, it's better to prevent these things and, not run into problems throughout the season than to spend a lot of time doing screening, because it doesn't really predict or give you an injury prognosis, but it does give you, I suppose, a function and performance benchmark. Next thing, I suppose, and anyone who's involved with sport and field sports, particularly looking at the yo-yo test, and that's sport specific testing, and it's done based on the characteristics of the sport. It's great again for Gaelic games, and it gives your team an assessment of their fitness and where they are with it. Good for Gaelic games, good for other field sports, easy to access. It's again low cost, like the GA15, so something that can be done, with a group that may not have the financial resources, and it can be done in club settings. It's very time efficient, and the best thing about it is the whole team can be tested at once, so you're not going through this specific test with each individual athlete. And the same thing applies to GA15. You can get your panel of 30, 35 people together and do it all together. So it's a good way to get everyone together, and it's very efficient. So just that, I'm kind of coming to the end of things now, and the basic tips for injury prevention are: if you feel something, flag it, tell somebody, look after and listen to your body are the most important things, I think. If you get an injury, if it occurs, seek your help early on. I think that's probably the best thing. And if you flag those injuries early, you're more likely to hopefully prevent a more serious injury. And the worst thing of all is more time. So nobody wants to be off for long periods of time. From an injury prevention point of view, use the ones that are out there. They're evidence-based, they're validated, they're easy to use, and most of all, there's no cost involved with them, and they're they're very beneficial, and your players will thank you at the end of the season and coaches particularly as well, if the injury levels are a little bit lower. And then if you're getting advice about an injury, take your health professionals' rehab advice on board. Stick to the agreed treatment plan. And it's not just the physio or the doctor; it's the dietitian, it's the psychologist, it's everyone that's involved in your care if their input is required. The treatment plan is very important to stick to it. Some people, they might get the plan, they're told to do it twice a day, they do it 3 times a day. Sometimes less is more. So really sticking to your plan and kind of going back and reassessing things is really important. So that's kind of the end of the talk. I couldn't finish the talk without putting in a Waterford legend there, and I had to put a bit of balance in there and put a hurl in his hand as well. So happy to take any questions.
Dualtach, I might just jump in. A question just came in on the chat there. It seems some of our attendees today are coaches for underage teams.
Yeah.
Have you any advice for those coaches, would say, that are coaching the future stars, the future Waterford hurlers, the future Waterford athletes and footballers?
Yeah, I think injury prevention and good education from a young age is really important. And if you're in a coaching setting and you have a group of players and you have the time to do it, starting off with the GA15 or the FIFA 11 Plus is a great place to start, because it's very well laid out, it's evidence-based, and it's known to work. What we're doing with the Meath footballers, again, from an underage, under 13, where they're at the academy level, working through from there to minor to under 20s, we're giving them that education piece that they can, improve themselves and then go back to their clubs and improve their clubs as well with this little bit of information that they have. But the injury prevention stuff, there's no kind of magic potion, I suppose, to it. It's getting these players doing it from an early age, and giving them the education to do that, and to realize that they're doing this because later on down the line they won't develop the serious injuries if they're well educated. They know how to do the specific exercises prior to playing their games. And what we've found in Meath in the last few years, since we've started that injury prevention type thing with the younger players, that when they come into us at a senior level where they might still be quite young and they're playing against lads that have been playing for the counties for 10 years, they don't seem to be developing the injuries like they might have, or they can approach the injuries in a better way because they're well educated on it, and they understand that in order for their bodies to kind of stave off these injuries or recover better, that they've done the injury prevention, they know how to approach it, and they're well educated on. And I think a big part of it's an education piece, and we're finding that that's really helping with their underage teams when they do come up to the senior level, that they kind of almost know what to do. And then when the physios, when they have contact with the physios, they've had that all the way through, and they can approach their rehab in a much more balanced kind of way. I don't know if that answers the question now.
Yeah, no, I think, I suppose if we get them early and do the right things early, that's probably half the battle.
Yeah, and with all the GDAs and stuff, particularly in the GAA, like, they're doing great work in the skills as well. They're working on skills and they're working on their stuff as well. And I think the GAA are very conscious of player welfare as well. And there's a lot of work going on behind the scenes, and specifically with that research, to try and prevent injuries. And then looking at the split season now with the club and county as well, where players aren't being overloaded playing for the clubs, the county, and then lads or girls playing with their schools and with colleges as well. So the split season, I think as well, it'll probably take a bit of the load off the players, and hopefully reduce injury rates.
Okay, great. Is there any more other questions there? I'm just going to check the chat there for another question.
I just want to say, sorry, Avril, if I could jump in there as well. Just to say, it's not a question per se, but I've spent a lot of time running all my life, and I also have helped out with the local athletic club for 15 years now at this stage. But recently I had quite an injury myself, and I was referred to with Arena to the physios there, and I've done a lot of fixed jobs with putchings on my legs and everything at some races, and I'm dealing with a girl, Elaine, there for the last few weeks, and it's been unbelievable, my recovery, and recovered a lot of other things while she was recovering one other item. And it's absolutely brilliant facility we have on our doorstep, and I think it's just brilliant to have it there.
Thanks for that feedback. Yeah, I'll pass that message on to Elaine. I think she gave a talk there last week. But yeah, we're very fortunate with the staff that we have in the clinic, and they work very hard, and they're very well educated and very keen, and it's great to get feedback like that. But and I'm glad to see that you've had a good outcome yourself. So
yeah. I mean, initially when I went to see Derek O'Neill first, and he told me I could do nothing for 3 months, I was going, he doesn't know what he's talking about. But yeah, they've given me a different program every week, and it's really brought me on.
Great stuff. I appreciate the feedback, and thanks for that.
No problem.
I have another question here for you, Dualtach.
Yeah.
What is the best approach to managing the struggle to get fit without injury for someone who is also carrying additional weight, which might restrict movement?
So kind of like what I said at the start of the talk, just start off with the very very basic type of exercise. There's loads of different programs out there. Like the Couch to 5K is probably one that's very widely publicized, where someone who mightn't do any kind of exercise at all and lead a very sedentary life, and then the aim of that is to go from a kind of a sedentary type life to having a goal of running a 5K. Now, your goal mightn't be to run a 5K. It might be to, if you're carrying a bit of extra weight, to lose a few pounds, whatever it is. But the important thing is, what I would say is not to do any kind of crash or fad diets, not to, there's a lot of fad exercise and stuff out there. WHO recommend 5 times per week to do 30 minutes of exercise. And that might be, whatever you can do and whatever you feel comfortable doing. It's not going out for a 30-minute run. It might be going for a 30-minute walk. And if you can't do 30-minute walk to start off with, it's starting off at what you feel is comfortable to you. So what we always say is, you want to exercise where you can, if you're walking along with someone, you can comfortably talk to them, and then progressing on to that, maybe being able to have a conversation, but being a little bit kind of red-faced and a little bit out of puff. That's okay. And specifically if you're carrying a little bit of extra weight, it's just making sure that you're not doing anything to injure yourself or hurt yourself. But there's a lot of things that people can do if they're carrying a bit of weight. Some light resistance exercise as well is great. Walking is great. If you enjoy swimming, if you getting out on a bike and stuff like that, non-weight bearing exercise, if someone is carrying a little bit of extra weight, is probably a good way to go as well. Things like cycling, swimming, because you can still work on your cardiovascular system, but not putting that impact through your joints where you may develop a bit of pain. So I'd say start slow and then work up on what you can do. And if you kind of stick to that, it should hopefully give you the outcomes that you need.
Great. And there's just another question just about the importance of a warm up and a warm down. Could you just give us a little few thoughts on I'm not too sure, just your thoughts on a warm up and a warm down, probably in relation to the question beforehand, maybe not on the elite side of things, but maybe we're getting out there to do our exercise and we're maybe not warming up and warming down sufficiently. Maybe that's where some of these injuries are occurring.
Yeah, warm ups and warm downs, they're very well documented. I mean, if you have a plan, say, to go out and whatever type of exercise it is, if you plan to go out and run 5K, or if you plan to go for a 30-minute walk, or if you plan to run a marathon, I don't think it really matters, because what you do prior to is very important, and what you do afterwards. So the warm up is basically getting your muscles activated, making sure you're good and flexible, so you're not stiff and you're not kind of going out on kind of out cold, basically, for want of a better word. It's about, say, if you plan on going for a 5K run, it's starting off with a low, kind of a very light jog, just kind of it's about getting the heart rate up, getting the lungs working, getting your breathing kind of nice and well regulated and stuff like that, and then making sure you're good and flexible. So whatever muscle groups you might be working that day, or you might be walking on, or whatever, just doing a nice light stretch of the various different muscle groups. It's amazing what's out there on things like YouTube about stretches and flexibility, activation work for those muscles as well. And then when your exercise is over, to kind of do that as well. So if you've done your main block of exercise at that whatever intensity you decide to do it on, to slow yourself down. So don't just come to an abrupt stop, but slow yourself down. Again, work on that flexibility. Look at those things that I've mentioned about recovery, getting into a pool, bit of non-weight bearing exercise, making sure you're well fueled, and maybe a bit of hot or cold as well. Probably cold is probably better after exercise.
And just one final one there, Dualtach. Is there any resources that you would direct people to find out a little bit more about what we were talking today? Obviously, I think it was Elaine was talking about the facilities out in WIT Arena. They're certainly, as somebody said to me recently, they're certainly world-class facilities out there with world-class technicians and practitioners out there. So I suppose we're very lucky to have that on our doorstep. But is there other resources that you can that you would or advise some of our attendees today, just to refer to? You mentioned there about the FIFA 11 Plus and the GAA one as well. They're on their websites, I'm assuming. Yeah.
I think from an injury prevention point of view, if you're involved with team sports and specifically field sports, they're a very good place to start. They're free to access. They go through very specific types of strengthening movements. There's the warm up component to basically they're warm ups in one sense. They have the various different components, and you're looking at a bit of strengthening there, and then sport specific stuff as well. So what I would say is I'd probably consult those first, and if after that you're like I kind of touched on in one of the previous questions, I'd be very mindful of the types of fads that people can kind of get caught up in. So if you're seeking something, making sure that it's evidence-based, and that's why I'm going back to the GA 15 and the FIFA 11 Plus, because they're evidence-based, they're known to work, and they've been tested across thousands of people, and they've gotten good results from them. And even though they might have a label of GAA or FIFA, which, you know, is for soccer or for Gaelic sport, they can be applied across different sports. And if you are, you know, participating, say, in athletics or in a different, you know, different type of sport, it might be a case of where you go to your coach, if you have a coach, and say, look, I have this, what do you think? Is there anything you'd add in? Is there anything you take out specifically to that sport?
That's great. I'm just wondering if there's any more questions out there. I think I've taken care of everything there in the chat box. Just throwing it out there if there's anybody else has any questions. Dulta, you've covered so much there this morning. Thank you so much indeed. Certainly, mind your hamstrings is something that I'll be taken away from this morning. And I suppose the importance of that warm up and the warm down. And I know as our partners in this wellness month, we've covered a couple of topics, and you know, this was something that was we've recorded and we'll send out to those that attend this morning, and they can share it within their own networks, and if they're involved in clubs and that. And obviously UPMC are there, and their experts are there out in Whitfield and WIT Arena. So yeah, as I said, we're very lucky to have them on our doorstep, and we thank you for their partnership in this Wellness Month. Just to remind you that our networking walk with Phil Healy's on the 31st of March at 5:30. We're meeting there in the car park by WIT Arena. Should be a lovely event, and what a great opportunity to get up close and personal with one of our Olympic heroes and a UPMC ambassador. And pop on to waterfordchamber.ie for more of our events for the Wellness Month and our social media as well. Dulta, the very best of luck to yourself and Meath for the coming season. As I said, Waterford will be nipping at your heels soon enough. We thank you very much for your input today, and for UPMC for your partnership. And thank you very much for everybody for attending, and have a great day. Thank you very much indeed.
Thanks, Avril.